In order to create the weekly audit, this is actually very easy. Click on Patient File, click on Patient File Statistics, and here you can do all sorts of statistics. You can look at the complications, you can look at all the admissions in a certain time frame, and you see the time frame here, and by default it's the last 7 days. You could also look for what have we got there, maybe operation reports, and have a look in there. However, for the operation reports, we do actually have something more comprehensive, which is the RACS logbook, or even the extended audit. As we do want several lists at the weekly audit, it would be quite annoying to click them all together. So what I did is you find this audit summary, and that basically creates all the lists automatically for the given time frame, i.e. the last 7 days. It starts out with the inpatient list, and if you scroll down, and please note that in this inpatient list the private patients are actually included. Furthermore, you then see the internal consults within the last 7 days with a diagnosis, history, and so forth. And if you want any further details, just click on the respective entry and you would see the complete entry in there. Click on patient file, file statistics, audit summary again, and there you are. So these are all our audits from last week, and then you would see the discharge list within the last 7 days, and again here looking just the same as the admission as the current inpatient list, just in this case all the discharged patients within the last 7 days. You would then have the list of operations within the last 7 days, and you can actually here see the status of these, and by now, i.e. after the at the weekly audit, they all should have a status either as done or cancelled. Make sure that when you cancel an operation, as I showed earlier, to put a comment for the reason of the cancellation in there. And at the end you would find the complications within the last 7 days, and obviously we didn't have any complications in this time. If you want to have a closer look at the statistics, please click on patient file statistics again, and you could then say, okay, I want to see the comprehensive consultations, I want to see all the letters, or what else do we have, progress notes, orthopedic consultations. These statistics come up automatically, and there's nothing else that needs to be done. If you want to have a look at the audit data, which is the logbook for the trainees, just simply click on that and you would see the logbook summary of the current logged in doctor. In this case you would see the total number in this case is 260, and you can then show another couple of information if you like, i.e. the operation magnitude and the complications, which is usually not required by the college when you have to send in the yearly numbers. But if you want to have a look at your own complications, you can then have a look at the discectomy, for example, and look at the complications here, and it shows you the complication rate. If you want to look at the extended audit, which basically complies with the college's extended data set, you again see the number of procedures of, in this case, acute subdural hematomas that you have done as a primary surgeon or as a secondary surgeon. You see that on how many occasions the consultant was on the floor or just scrubbed. You see the total number. You see the insurance statuses, the operation magnitude, major, complex, or whatever. You see the ASA grades, the anesthesia, i.e. general tubed or local anesthetics, and so forth. You see specific risks and special prophylaxis used in that on that category, and you would see again the complications. How can we actually create these entries? This is very easy. When you do have a patient, let's look for our patient Mr. Mustermann again, and go to his patient file, and then it's very easy. We just create the operation report, which we have to do anyway when we do an operation, and you just choose the appropriate entry here from that list. This college logbook in this case is the official logbook entries or categories as proposed by the Royal College of Surgeons. However, it's very important to note that these entries can be very easily adjusted, changed, or extended if needed. Let's say we did an intervertebral lumbar discectomy, and we save that, and then you see that it's shown up here. You can then choose to verify how the magnitude of that particular operation was. In this case, if you have a discectomy, it would be according to the college and intermediate procedure, but as you point out what the magnitude of this intervertebral disc was, let's say it was a second or third recurrence and it was very scar, you could actually make it as a complex procedure, which is in according to this category logbook. You would put in the date, and by default the current date is put in, and you could put in the time, i.e. let's say 12 p.m. to 14 p.m. for example. You could put in the insurance status, and if one insurance status is missing, you could put another one in there, i.e. TAC for example. Just mark it here and put it and choose it, and then it will be available for the next entry as well. Put in the location, i.e. theater 3 in this case, and let's say I was the primary surgeon and the secondary surgeon was somebody else. Let's say one of the residents here, Tracy O, and Mr. Danks was the supervising consultant, and he was in the building. Good. Here we've got our specific risks. Let's say the patient was previously operated at that area, and the wound was actually infected, and the patient is suffering from obesity and diabetes mellitus, and he's actually a smoker as well. Here you could choose what type of anesthetic you used, and as the wound was infected, it's probably not reasonable to use a local anesthetic, so he was generally tubed. Well, actually he was very difficult. They used fiber optic intubation. We started and continued antibiotic therapy, and we gave TED stockings and used sequential compression devices. As this patient is quite sick, he's probably an ASA 3, and we would save that. And once this is saved, the entries here on the side would, here's on the building, there we are, collapse down to save a little bit of space. Scroll down and you can reuse the diagnosis. In this case it was an L5S1 disc prolapse, and we would use, let's say we did a, what did we do? Just a, oh, we actually don't have it here, decompression. There we go, Microsoft decompression neurolysis to foramen resuscitation level L5S1 is what we said, and here it was a recurrent L5S1 disc prolapse. Make sure you put in the size as well on right. Okay. In the indication we usually put some preoperative history, and this is where previous entries come into play. You would go and say look for presenting complaints, there we are, and say this patient had sciatica for 6 weeks, and where are we? No, the where is it? No. Could say the examination, there we are, he's fully oriented, and we could go back to the phrases and would say he did informed consent, bing, there we go, save that. And we've got it. Save it again. Go down to the operation report and use your common phrase for there as well, and say, and just enter the bits and pieces and that are specific to this patient. In this case, L5S1, L5S1 interlaminar window, and the, let's say in this case it was S1 nerve root was compressed and so forth. Right. And obviously you would have to go through and make sure that what your common phrase is talking about does actually reflect what you have done. Let's assume that is the case. You could put in a complication in there and say a very nerve root, for example, and you would say you caused a dural tear with CSF leak and damage of neural tissue. And you could go for the treatment plan, and we would say here we want some routine post-lumbar spine surgery. There we are. Save that here, and off you go. I want you to note that we do have an editor here, so you can actually say mark things and make them bold and underline, for example, if you would want to highlight certain things. You could send a copy to the GP as well if you have put that in before, and you would save that again, and then you can print it. This is how the default printout would look like, or you could use, in our case, the Southern Health form to print it out. Here we've got several sites, so I would mark the respective site for that and just print it out and go home. Very easy, very quick.